Action plans are plans that coaches help patients make towards a healthier lifestyle. Patients choose what they want to work on. Coaches help the patient plan the specifics. At the end, the coach sets a follow-up date to check in with the patient about the plan. The health coach in this scene doesn't ask the patient what he wants to work on. She is pushy and just tells him what his action plan will be. The patient doesn't get to choose his own plan.
Hi, Willie. How are you?
I'm okay. How are you?
I'm good, thank you.
Good.
So the doctor wants to bring down your hemoglobin A1C.
Okay.
So one way to do that is by exercising. Do you exercise at all?
Yes. My favorite is walking. But when it's bad weather, I don't walk at all.
Okay. So remember how we talked about your A1C and how important it is to bring it down? So by exercising, you could bring down your sugar. How about we make an action plan around that?
Okay, but when the weather is bad, as I say, I don't walk at all. Is there any other exercise plan? I don't know of any other exercise plan that I could do.
So when the weather is bad outside, you could exercise at home. You could turn on the music and dance around a little bit.
I don't like to dance.
Really?
No, I don't. You think I could cut back on my intake of rice?
Sure, you could do that, but the best way to bring down your sugar is by exercising. So let's focus on that.
Okay.
Now, Adriana, the health coach, will help the patient make a plan that he chooses. She is supportive and helps him with the details of his plan. At the end, she correctly sets up a follow-up date to check in with him about how he's doing.
Hi, Willie. How are you?
I'm okay. How are you?
I'm doing good. I'm really glad you came to your visit.
Well, I'm happy to be here.
Good. Is it okay if we talk about your hemoglobin A1C?
Yes.
All right. Do you know what a hemoglobin A1C is?
I have an idea. It had something to do with my blood sugar level.
That's right. So let me show you a graph. This graph here shows that your hemoglobin A1C is measured within the last 3 months. So that kind of gives you an idea of where your diabetes is. So just to see that I made myself clear, what's a hemoglobin A1C?
It's a measure of your blood sugar with a test that will tell what my blood sugar was for over a 3-month period.
That's correct. Do you know what your A1C is?
I saw my doctor the other day and he said it was about 10, I believe.
It shows here on your chart that it was at 10. So do you know what the goal is for a hemoglobin A1C?
No.
So your goal is set below 7. So how do you feel about that now? Now that you know that you're at 10 and the goal is 7.
I think I need to take some serious action to reduce it. I think it's some time for me to act.
Okay. So do you have any ideas what you could do to try to bring down your A1C?
Exercise. I like exercising.
Yeah. That's one of the things you could do. Exercising, changing your eating habits, and taking your medication properly. Is there any one of those that you'd like to work on? Heard you mention exercising.
Exercise would be my preference, yes.
All right. Do you walk now?
Walking would be my preference, yes, and I walk now.
All right. So how much walking would you like to start with?
I'd like to set a realistic goal of 2 days a week.
That sounds good. Which days of the week would you like to walk on?
I like to walk on Wednesdays and Fridays.
All right, so Wednesdays and Fridays. And how long would you be walking?
I would like to walk 30 minutes.
So 30 minutes. That's really good. All right. So Wednesdays and Fridays for 30 minutes. And where would you be walking?
I like to stay in my neighborhood.
That sounds good. Is there anything that would prohibit you from taking your walks on Wednesdays and Fridays?
If there's bad weather, I will not walk, okay? But I will make it up the next day or as soon as the weather improves, so I'll keep it at 2 times a week.
Oh, that sounds really good. So just to make sure that you're going to be walking on Wednesdays and Fridays on a scale from 1 to 10, How sure are you that you're going to be doing your walking?
Definitely,
With 10 being, I'm absolutely sure I'm going to do this.
definitely an 8.
An 8 sounds really good. That sounds promising. So when can you start?
Today is Tuesday. I don't see any reason why I couldn't start tomorrow.
Tomorrow being Wednesday.
That's
All
right.
right. So can I call you to see how you're doing?
Yes, Tuesday. You can call me on Monday.
So I'll call you on Monday just to see how you're doing. And just to make sure that we're on the same page, what are you going to start doing tomorrow?
Tomorrow I'm going to start exercising, walking, and I'm going to walk for 30 minutes. And from that day on Wednesdays and Fridays, I'm going to walk for 30 minutes.
All right. And where are you going to be doing your walking?
I'm going to stay in my neighborhood.
That sounds great. Good.
Thank you.